Hello and good morning to the third day of the Human and AI Symposium. We're going to kick off today with this wonderful panel discussion on human centered healthcare. And you might be wondering, isn't healthcare already human centered? Well, we're going to talk about that today. Uh, and with us today is Cedric, Giuseppe, and Michelle. We're going to start out with Cedric. He's going to give us a few words on who he is and what he does, and then we'll move on down in alphabetical order. So,
Thanks, Joaquin. So happy to be here, Cedric. I have a biomedical training, a PhD in biology, postdoc, and then an MBA of Management of Innovation, 25 years of experience in the public and private healthcare sector, mostly on the pharmaceutical drug development research, manufacturing, and digital transformation, let's say. I'm currently the head of knowledge extraction integration at Roche TechOps division, where I'm supporting many use cases to improve our business, leveraging knowledge graph, artificial intelligence, machine learning, and traditional data integration pipelines.
wonderful. Well, the pharma perspective is certainly going to be interesting. Giuseppe, would you like to tell us a little
Yeah.
bit about yourself?
Yes, thank you. Thank you very much, Joachim. I'm really happy to be here. And I'm Giuseppe. I come from Italy, and I currently work as a AI educator and consultant. I'm also a book author of a book for demanding publication, which is called Knowledge Graphs Applied. I'm really interested in different aspects and perspectives of AI technologies that includes knowledge graphs, graph neural networks, and large language models. And in the last 10 years, I worked and I try to apply these technologies in different fields, from cultural heritage to healthcare. And I would say that I'm really interested in the today's discussion.
Thank you very much, Giuseppe. Michelle, would you like to go?
Yeah, thank you for having me, Joaquin. Good morning, everyone. My name is Michelle Curry. I am the founder and principal business solution architect for Savant Solutions for HIT in the US. I am a clinician and a master's prepared informaticist in healthcare, and I have over 2 decades of experience applying and leveraging technology to improve efficiencies, diagnoses, and patient outcomes in healthcare. One of my areas of expertise is in knowledge representation and in data and the status of our data quality in the US and the implications of that on AI and our ability to leverage AI in the healthcare domain.
Wonderful. Well, as you can clearly see from the perspective of the audience, we have quite a broad range of perspectives and experiences here. Now that we've laid down the introductions, maybe we can get started with the first question. What is this Messiah complex? Oh, you're on mute.
Sorry, I guess this one is on me. So yeah, thanks, Joachim. So this is something that I proposed yesterday also for the presentation. And when you look at Wikipedia, it's kind of clear that, assuming that Wikipedia, of course, is correct, or at least somehow correct, not perfect, of course, but it's something that we retrieve, that we find in many civilizations, many religions, many cultures, is this hope that someone or something, something being not human, will help us to get over all the suffering, the pain, and present and future. So this is not new. This has 1,000 years of existence, this concept. And the thing that is interesting to follow is that how this concept was embodied in the different culture over time. And I have the impression that nowadays this Messiah complex concept and complex is embodied by technology and more precisely artificial intelligence.
Yeah, I completely agree with Cedric. I have the same impression. And I would say that this religious perspective on the technology, as I was born in at the end of 1980s, right? So I started to think and see from the beginning of 2000, and I started to see this faithful in technologies, right? Because we can think about in 2000 we have this web bubble, right, in which there is a really strong and really crazy faithfulness in these web company technologies. Sometimes there will be company that in their names just have something like web or .com. They were focused on completely different stuff, but they reach a huge value, right? Just to provide you the idea of this craziness behind in that years. And I've seen the same approach regarding the big data vision of the world and big data technologies. It was really weird to me see something like that. We didn't need more research, right? We didn't need the human thinking about research results, because according to this big data perspective, everything was already in the data, right? Both the questions and the answers. And it's weird, right? Because this is a cycle, and the pattern is repeating again in this in the last couple of years about generative AI, right? In which we treat this technology with the same approach, right? And so we should become aware of our thinking beyond the technology, right? Otherwise, we will commit the same mistakes in the futures, I would say.
Mm-hmm. Mm-hmm. Yeah, just to add to Giuseppe's, I agree. It feels to me, and I've seen that we don't really stop to take the time to learn the lessons of whichever cycle we've just gone through. And so my fear is that we will repeat the same mistakes with AI and not learn from the past. And I'm guessing that we, unless we change our trajectory, we will experience kind of the same, lack of kind of realization of kind of the opportunities and what is possible. And we will just then look for the next greatest technology, and continue kind of to always face on something in the future that just seems to be, continuously beyond our reach for some reason.
So as we follow the buffalo running, we fall off the face of the cliff. Is that what's going on? Is it wrong? Is it wrong to wish for a better future for humanity?
I don't think it's a question of right or wrong. I think it's a question of our culture, how it evolves. Because I think this tendency to be more looking to the future rather than the present or from the past, when it comes to learning from the past and enjoying the present, instead of always thinking that the future would be better than present and just be happy with what we have in the present, is deeply enrooted in the Christian cultures, from the Latin culture. I'm not an expert with other cultures, but I think in some other Asian culture, this is more seen as a probably cycle rather than a straight line with past on one hand and future on the other hand, and always looking at the future. But I think this is a tendency that we have, and this is a bias that our brain has as well. So if we are aware of it, we can mitigate it. But if we are not aware of it, we might suffer from it. And some people who are aware of it might take advantage of the others being a victim of that. I'm mostly thinking of the advertisement industry, the marketing industry, all these guys leveraging the psychological aspect of our brain to make us always consume more and do stuff that basically we would not need, I would say.
Yeah. Yeah, I think I agree with Cedric when he said that this is a typical Christian way of thinking, right? Because in Christianity we have this idea of original sins, then we have this penance, and then we have the salvation, right? So we have this straight line that bring to, in any case, a bright future, right? But there are type of cultures that we already abandoned. For instance, in Europe we have a Greek. The original and the traditional Greek culture that was completely different, right? Because it was seasoned. So basically, we have a cycle, and it was more close to the natural way of the stuff. And then, so for instance, the smartest people were not the youngest, but were the oldest because they've seen a lot of seasons, right? And when you understand that there is a cycle in the life, then you are more aware and you are much more in contact with the reality, because the future, it's not there, right? So we cannot concretely talk about it because we can just talk about the present. So this is important, and it has an impact also in this religious perspective of the technology, I would say.
I think that's a really interesting perspective that I had not considered before. Coming from healthcare and focused on the quality realm for so long, those of us in healthcare who actually work on the front lines and who take care of patients and who are accountable for improving outcomes. We go through cycles of setting our goals and objectives, determining how will we measure if we're successful, and then really focusing on if we are achieving our goals. And so I think that there's particularly, I see in healthcare that there's a huge disconnect between, kind of the aspirational goals of those who really are just come from a purely technical background, or an entrepreneurial background, and who really don't have experience working on the front line. And so I think that there's a big disconnect between kind of the reality and the aspirations in healthcare, which I think is also one of the reasons why, AI and technology in general, at least in the US, has not really been very successful in healthcare. We haven't really been able to leverage it like we have in other industries so far. But I think that that's a really interesting perspective, the religious perspective, and kind of the the seasons that Giuseppe mentioned. I think it's really insightful.
Yeah. I don't know how to move forward from that one, but let's say I'll skip right into how do we embed iterative and guardrail thinking into the adoption of this technology. I mean, for one thing, I think we've mentioned learning from the past and trying to avoid the patterns of these hype cycles, right? These hype seasons. But I seek your counsel. Please advise me.
Shall we always go the same order, or you guys want to start? Please feel free. So, in my opinion, there is a paradox here, which is difficult to reconcile: is the pace of the business and the pace of the rest. Let's see, society, science, ethics, regulatory, and so on. Because the pace of the business is short-term, maximize profit, and in this short-term thinking, it's really hard to think, take time, investigate all the aspects that are to be considered, and set up those guardrails and everything that would be needed so that there is no falling into pitfalls or things that we didn't see coming because we didn't think it through. So these different paces are really difficult to reconcile, and that's why we see a lot of companies being fined or safety issues, especially in the healthcare, because people are going too fast to the market, focusing only on the monetary and the business aspect, and neglecting a bit what we call here human centering.
Mm-hmm. 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 Yeah, I'll chime in here. So coming from a clinical background and an informatics background in the US, and I think that this is true in the rest of the world, there is a resistance from clinicians anyway to what Cedric just described. There's kind of this real clashing kind of wills, I guess you could call it, between kind of this fast pace, quarterly earnings focus where we are just want to move and go fast. And in healthcare, in the US, there are various bodies and factions who are interested and who are proposing legislation, proposing guardrails and approaches for evaluating AI, including, the National Association of Medicine. The federal government obviously has recently come out with approaches for AI and guardrails. HL7, which is one of our main standards bodies in the US around data and technology, they are also coming out with kind of white papers and thought leadership on aspects of AI that need to be considered to protect patients, to protect patients from harm, but also to, protect privacy and security of the information, with the desire to have more and more data and larger data to feed and to train these AI models. And so, I think that while the temptation is there to always look, at quarterly earnings and to march at a continuously faster and faster pace, there are, the powers that be are starting to put some teeth into considerations around AI. And I think that, part of what I've seen that's different with AI and previous kind of hype cycles that we've been through that just somebody mentioned is that, clinicians in healthcare are really starting to put up kind of a strong front, kind of against that accelerated thinking and kind of continuously pushing forward before we really have considered the ramifications of what that will produce.
Yeah, based on what Cedric and Michelle said, I think that the complexity in the healthcare domain is related to the multi-stakeholders, right, that are involved in this specific context. First of all, we should think if the main important stakeholder, which is the patient, is put at the center. So this is something that we should reflect on. And on the other side, obviously, there are other interests and reasons around this specific field. So we should identify a way to harmonize, right, or this thinking, all these perspectives or these goals. And I see an interesting bridge between the harmonization of these perspectives and the technologies that try to harmonize different perspectives like knowledge graphs, right? I think that we can identify this sort of bridging and try to understand which technologies can be useful for and for which reasons, right? Because when we consider a technology, as mentioned by Cedric during his presentation yesterday, he said the technology is not good, but it's not necessarily good or bad, right? Because it depends on the goal. But I would add that it's also not neutral, right? In the sense that behind the development of technologies, there are always some political or cultural reasons. So we should also take in consideration the origin of a technology to understand how can we use it, right? Especially in a complex field like healthcare.
And also who owns it, basically, because the big discussion right now around AI is also because the organization driving that are mostly private, and even between them they disagree. When we see Meta going more open, with Lequin saying that AI should be open because it's an asset for humankind and should not be owned by private companies because they will have a huge privilege that they might abuse from, of course. So, and there are other technologies like knowledge graph, like you mentioned, which have been open source now for almost 15 years, where the discussion is different because RDF is open, it's W3C standard, and so this has to be taken in consideration as well.
I think we already answered this question, but I'm just going to put it out there kind of explicitly, and then I'm going to ask another one because I think we already know the answer. But are hospitals designed for financiers or insurance companies or to save lives? I think we've already answered that. But
It depends. It depends what hospitals. A striking thing that I could observe is that at the data level, I've been lucky to observe the data, for example, that we collect on patients at the MGH in Boston and at the Pitié-Salpêtrière in Paris. And what was striking to me is that in the US, most of the data that is collected, I'm not saying all of it, but most of the data is geared toward insurances for the claims. And in France as well, but proportionally less. So the proportion between data that goes for the claim to the insurance versus the data that is really, biopsies analysis, imaging data, clinical examinations, laboratory analysis, whatever, it's much bigger as compared to the claims data.
Mm-hmm. I think that's a really interesting point, and I would agree. In the U.S., part of what I think drives and contributes to that disproportionate balance between administrative data and clinical data is that in a fee-for-service world, we focus kind of at the transactional level, of one visit, kind of one disease, one diagnosis at a time. And so in a fee-for-service world, every service is reimbursed at a line item level. And so I think that tends to focus kind of not only the practice of medicine toward, what is billable, but then that subsequently influences the type of data that is collected and the type of activity, that is taken by a clinician. And so I would agree, with Cedric, that a lot of our data in healthcare today, that presumably AI is going to, sit on top of, is administrative data. From a billing perspective. And so it really, is fit for purpose for asking questions about utilization. But it's not necessarily fit for purpose for improving quality, for, determining what is kind of the constellation of patient symptoms, diagnostic tests, and diagnoses themselves. How do those three influence each other? How do they impact each other? And without rich information related to those three, we're really starving for the type of information that AI will be able to leverage to, discover new patterns in diagnoses, that will help us understand symptoms that are more latent, that really kind of have a long span to express themselves in some disease format. And so, that's one of, I think, the barriers that's going to be a barrier to successful use of AI in healthcare for those types of objectives.
And if I may add regarding what Michelle mentioned about how AI can leverage in which way these systems are able to leverage information. I think that something that it is not yet discussed so much is related to the openness of these models, right? Because we can clearly understand that if we use services, LLMs as a services from these providers like OpenAI, Anthropic, and so on, obviously we are interacting with fully closed systems, right? So we can't know nothing about how these systems works, how these systems are trained on, and so on, including potential sensible data, right? But I think that there is also another trap related to the open models, right? Because sometimes you have seen that there are some platforms like Hugging Face that allows you to download these pre-trained, and fine-tuned models, right? And actually, these models appear as open, but concretely, in terms of openness, they are not, right? Because if you are just able to download the set of matrices or parameters that enable you to perform a task, if these parameters are open and then you download it, it's not enough, right? In the sense that you don't know how these models are trained, on which data, you do not have information about the fine-tuning phase, right? So which are the instructions that are provided after the pre-trained phases in order to improve the quality, right? So I think that it's a bit risky. It doesn't have a broad and complete information about these models when we have to use them in such critical domains like healthcare, right? So we should also, I think, consider this point, that what we consider currently open model, it's not totally open in the sense that we do know actually crucial details, right? So for instance, the data that these models were trained on, the set of instructions that are used to fine-tune these models. I can understand that there are some obviously reasons behind this choice of not share this type of information. But then on the other side, we have to be clear and we have to be transparent in openness relating to this model, I would say.
Circling back and to the question, Joaquin, that you asked about some of the guardrails in healthcare from a clinical perspective, two points really stand out. And Giuseppe, this is exactly what you're talking about. It's about kind of the transparency of these models, what data is used to train these models, and the explainability of how all of that comes together to generate a recommendation or a response. And, in healthcare, because of that lack of transparency and that lack of explainability, that really, creates an ethical dilemma in healthcare for clinicians who, will we get to a point, for example, where, insurance companies will say, unless you use these AI tools and follow these AI recommendations, the services that you provide will not be reimbursed. But the clinical question is, where's the accountability lie for, the potential ramifications of these closed models and the impact on real, on lives. And so there's this, I think there's a lot of internal struggle in healthcare with AI, because, healthcare is really starving for effective tools and effective technology to help manage the workload and the cognitive load of medicine. But there is that question, and there will remain that question about where does that accountability lie, for AI that, provides recommendations that are harmful as opposed to helpful, and without slowing down and taking the time to do research, and lack of openness, as Giuseppe mentioned, that really creates a ethical dilemma for us.
So this is there is anyway a fundamental paradox with artificial intelligence, and because it's we hope and it's designed for at some point being more intelligent than us human beings, because it will solve problem that we are not able to solve ourselves. Okay, so given this postulate, how as human can we judge this intelligence if it's higher than ours? So at some point we'll have to have a choice to make. Do we trust it or not? Because we will not understand it basically at some point anymore. And
Right.
it's already a bit the case. When you look at the paper that goes deep into the neural network, they see some loops happening, like serial operation that might give some new patterns emerging. Anyway, it's not clear. I'm not an expert here. But either we trust it or not if we don't understand it. Because it's more intelligence than us. So the accountability then, it's not a question anymore. If we decide to trust it, it's gonna be accountable basically, and the human is out of the equation, and this is a risk, of course. If there is no human in the loop anymore.
Right. But then where does the accountability lie? Because it has to, at the end of the day, the buck has to stop somewhere, right? For especially when there's injury or death. And so, does the accountability lie with the companies that create these tools? Does the accountability lie with a payer, for example, who is saying, we will only reimburse certain types of care that is influenced by artificial intelligence? And I think where the medical community is right now is that I think the medical community is comfortable with getting to the point where we trust something that we don't know how it works, because we've seen that throughout civilization, right? When we first discovered fire, we didn't understand how that worked, kind of going all the way back. But I think for clinicians anyway, as long as they understand the data, where is the data coming from that is being fed into these algorithms and these tools, and is that data truly fit for purpose for the question that we're asking? I think if we can address those two questions in healthcare, that clinicians will feel comfortable leveraging tools that are beyond kind of our human capabilities, right? For answering questions. But I don't think that solves kind of where the accountability lies.
Yeah, maybe Giuseppe, you want to add something? Because I just want one thing to mention here.
Yeah, just a quick point on what you mentioned, Cedric, about the intelligence. I think that the idea of these LLMs is that they have an intelligent behavior without being intelligent by themselves, in the sense that if you're thinking about these the key principles behind the text generation, right, which is based on training of the prediction of next words, it doesn't look like an intelligent behavior, so the capacity of manipulate complex symbols, but in any case it works, right? In any case, it has the results, the produced result, it's enough, right, for a human, because it seems true, it seems that it's able to reason. And sometimes I make this example. Consider, for instance, the task of washing dishes, right? For creating a system that is able to wash dishes, we could create a very complex robot that is able to coordinate, that has hands, and it is able to coordinate fingers in order to make the complex movement of washing dishes. Or we could create a box in which we put dishes, and it becomes a sort of swimming pool and cleans the dishes, right? I think that there is this sort of similarity. I mean, the task is reached, the result is reached, but the way in which it's reached is not the smartest way, right? But it works
Sure.
in any case. That's my
Yeah.
theory.
No. The problem starts with calling it intelligent. I think it's a misuse of this word, and it gives the belief to the non-expert people that it's truly intelligence. But as you said, I mean, it's just using statistic and based on probabilities of the next pixel or the next word. So it's syntactically it's correct, but there is no semantic in there. It's not thoughts. And the thing that I just wanted to add to Michel is that I don't think there's going to be one size fits all medical solution, AI, because you're right in saying the data, but there is also the logic in the model. And the logic has to do with what data it was trained. And we all know that some treatment that works with a Caucasian population will not necessarily work with an Asian population. So I think for AI, it's going to be exactly the same. You'll have to have the right training set to apply to the right patient population with kind of same as a clinical study inclusion exclusion criteria to train the machine.
I was just going to add to that, Cedric. You hit it on the head. That idea of fit for use and opaque data models, they're part of the same problem, right? You can develop a proof of concept in one hospital and collect data and build a model, and it's unique to that geography, population, diversity, age group. There's all these different variables. But then what if you want to say, wow, like this is useful, we can scale it to other hospitals all over the world. Orange people and purple people and green people do not have the same biological tolerances and constraints. We'd like to say we're all equal. Biologically, we are not. Biologically, there's little nuances that, some people have more oxygen than others. Some people have different heart or lung capacity. I mean, it's just it's a fact, that people don't need to acknowledge.
Yeah. We're gonna have personalized treatment and personalized models,
So, how do we manage? Let's scrap everything that we've talked about so far. How do we manage a complex, dynamic, and volatile environment with a trustworthy support system?
I'm not sure we can manage. We can try to manage. We can try to manage, but there is anyway a go by the flow phenomenon. I think we had one of these questions that you prepared. What's the percentage of the population that is concerned by AI? I mean, in my answer would be all of the population. As soon as you use a digital device, unless you are living deep in the Canadian forest with no electricity, no mobile signal, nothing at all digital, then yes, you are not concerned. But as soon as you are part of the digital web or matrix, you are touched by AI. Whether you like it or not, it's another question. But your data is used; it's feeding a system, it's feeding an algorithm, and output is derived from that.
I think that I would like to add that I think that there will be some disparities in how and where AI is used, primarily driven, financially. In healthcare, I think that, large urban centers will be, the first to kind of embrace AI, whereas care delivered in rural settings, for example, where they don't have as much, money to pay for these types of tools, that there may be a disparity there. I think that there also, may be some bias toward leveraging AI where there's more benefit, potentially, for example, with children. If they have a longer lifespan, there's potentially more benefit of using AI to improve that, as opposed to, for example, with people who are at the end of life, right? And so it really kind of again gets into those gray, kind of ethical questions about, how and where. I mean, I think everyone would agree that ideally that those biases wouldn't exist and that those limitations didn't exist. But the reality, unfortunately, is that, they are there. And we've already seen from the past. I always like to say that the best predictor of the future is the past, and we have seen these situations play out historically in healthcare. And so I hope that either, kind of the ubiquitous of the technology or, financially, that somehow we are able to ensure, that these technologies are freely available, fairly used. But I think that, there are, while I think that AI is available and will be available to everybody, I'm not sure that it will be used consistently and equally across different populations and different types of care settings.
Yeah, and if I may, Joaquin, regarding your questions on trustworthy systems, right? I think that the semantic web and the knowledge representation communities try to develop tools and artifacts in order to build this kind of systems, right? Because their perspective was, I try to explicit all the knowledge in a very understandable way, right? Which is the opposite approach used for developing LLMs or generative AI systems, in which you compress the knowledge in order to make the systems more effective and efficient. So ideally, if we would be able to leverage this effort from the semantic web and the knowledge representation communities in terms of developed ontologies, for instance, I worked a lot with multiple ontologies like SNOMED, UMLS, human phenotype ontologies, and so on. And I noticed that they are really transparent, right? They are really obviously complex artifacts to manage, but I would say that in this case we can make a bridge, right? Because generative AI and LLMs are really powerful in verbalize stuff, right? They are able to verbalize everything. So if we are able to identify and extract the information we trust in these ontologies, in these source of knowledges, and we are able to incorporate this information into LLMs, then we can use the LLMs in order to verbalize and manipulate in a very effective and clear way. Because I think that one of the key problems of knowledge representation and ontologies and so on was that they had a lot of knowledge, but it's difficult to interact with them, right? But now we have a tool that is able to simplify this interaction, because its capacity of verbalize everything could be in some way leverage, right, to exploit these very trust and explicit information. I would say this could be a way, I think.
Let me penetrate this question through a different lens. How do we inject human reasoning into the machines that support the frontline healthcare workers? That's a little bit safer, because if the healthcare workers wield the machines and understand how it functions, it should be less of a liability, no?
I think that knowledge graphs, to Giuseppe's point, and Cedric, we've talked about this earlier in the conversation. Knowledge graphs represent reality, right? They represent the entities and the relationships that reflect kind of real world situations, if you will. And so just by their very nature, they represent, the human kind of experience, if you will, and kind of the representation of that, in a concrete way. And so, as opposed to, and this is, my naive understanding, I'm not probably as technical as Giuseppe and Cedric, but LLMs and some of those types of technologies, they're able to generate information or provide information that is similar, to a prompt. But without a knowledge graph, they're not able to explain how or why they are similar. And so without that, we're not really able to make that leap to causation, or cause and effect, which is what we care about in medicine. We really in healthcare focus on, if we do this, what is going to be the effect of that? What has caused something to manifest itself? And so I think knowledge graphs, because they're grounded and representative of the real world and real world scenarios, that is a way to inject kind of the humanness into these types of technologies.
Giuseppe gave a pretty hearty presentation on entity resolution a while back, and he made a very clear point on discussing Zika virus. Zika virus can represent multiple things to multiple people. I got bit by a mosquito, I have Zika. I go to the hospital, they identify I have Zika based on the symptoms. Now they have to go to the pharma company and look at the producers that have pharmaceuticals that combat the Zika symptoms or have a treatment plan. And those are all very different perspectives on the same kind of knowledge or an idea.
Mm-hmm.
So, yeah, I mean,
Yeah.
it's
Because as you mentioned, Joaquin, exactly. I mean, the term Zika can have multiple meanings, right? It could be referred to the virus, or it could be to refer to the disease itself, or its form of disease that causes, for instance, fetal malformation. So depending on the context and depending on your goal, you are more interested in detecting, for instance, pieces of text that mention Zika virus, because, for instance, you want to develop some policies in order to make some limits to potential pandemics or so on, or you want to explore the consequences and the symptoms of diseases, right? So in that case, where the similarity and the meaning are very close, while in ontologies like SNOMED, they are clearly represented as two distinct entities. When the system, like an LLM, should extract information which is quite similar in some way, it becomes harder, right, for this type of system. While in some specific contexts, understanding the differences is crucial, right? So this is another point.
I think that's a really good real world example of what I see happen in healthcare all of the time, where the concept is an elephant. However, this group is only looking at the tusk. And so they have a very different perception of what that concept is. Likewise, another group is looking at the tail, and what that means and what can be accomplished with something like a tail. Another one is looking at the ears. And so each individually, to your point, Giuseppe, they have a very unique perspective on a concept like Zika or elephant, but their concept is not holistic. And it's not really a complete picture of what that concept means. And so I think, that this really gets to knowledge representation. How do we represent knowledge? At what level of granularity? At what level of abstraction are we looking at entities? And it does have implications when you don't understand how those different viewpoints are reconciled. Because at the end of the day, they all come together and are going to influence each other and be influenced by each other, those different perspectives in the real world.
Yes, that was my point yesterday with the system thinking.
Yeah.
And this is again a pitfall that humans are always falling into, because the way the human brain is dealing with complexity is that it chunks it in smaller parts and try to solve the smaller problem, thinking wrongly that the sum of the local problem, so the sum of the local solution, will result in a global systemic solution, which is not true as per the system theory.
Right.
But having
Right.
this exhaustive view, again, requires time, requires effort, requires expertise. And this time, effort, expertise is not resulting necessarily in a financial profit. So this is not reconciling with this profit-oriented mindset.
Right. The other thing I would say is that in healthcare, because of the complexity and just the sheer magnitude of information, I mean, healthcare is all about specialization, right? We have specialization in which type of medicine people choose to practice. We
Yeah.
have specialization in the administrative functions. You know, some focus on, you know, utilization management, some focus on billing, you know, some focus on revenue cycle. And so, you know, to your point, there aren't a lot of people, I would say, that exist in the healthcare space who are able to connect all
Yes.
of those dots and those siloed perspectives, which is a
System
risk.
medicine.
Right, which is a risk because, you know, to your point, Cedric, without that system perspective, we fall into the trap of thinking that a symptom is the problem,
Yes.
rather than just a symptom of the larger issue at hand. And so we then solve for that small piece of a problem. But what often ends up happening in healthcare, because all of the operations are so tightly coupled, we end up solving for one thing, but then we break something else, you know, further downstream that people aren't aware of.
Yes.
And so I think that potential exists with AI as well, without kind of that system perspective.
Not even saying the human aspect of it, because all these medical doctors, they all think that because they are specialists, they have a hammer and all the problems are nails.
Exactly.
So and then there is a fight starting with so anyway, it's very complex indeed.
Yeah.
To make matters even more complex, because I like to make bigger problems, the hospital system, the healthcare system, is part of a larger system of society. And if we talk about Zika, we're not just resolving the patients that have Zika virus and have these problems. It's the environmental causes, or the policies, or the architecture that allows for water to pool in an area and mosquitoes to deposit eggs. I mean, it's a much larger much larger model to take into consideration.
So
Exactly.
I was going to say, I have a question for, you know, for my fellow panelists, and for you, Joaquin, is, you know, do we think that AI will be capable of bringing that system kind of perspective to, you know, to our problems? Because that is a very real limitation of humans. Is kind of that inability to see that system, because that is, you know, just the expansiveness of kind of the information and the expansiveness of the perspective. You know, is that something that AI could help with? You know, if that was the case, that would be very beneficial. You know, because not only do we have limited resources who do that, you know, like you said, it takes time and effort, and I would say, you know, intentional action and activity to achieve that higher level system perspective.
I like that idea that Cedric brought up, that we only reason and chunk our immediate reality and our immediate body of knowledge. I think that for us to get augmentation from tooling, we have to have a shared view of reality with the tools that borrow from the same resolution, the same domain. But then also that's the systems thinking. Those realities need to be interlocked or interoperable between each other. But you should be only limited and get explanations and get citations from the tools that immediately impact your reality, because otherwise it's cognitive overload. You might not know what to do with that other information. I mean, how much knowledge do you need to make a decision? And will that decision make you more effective or make your operations leaner? I don't know.
Giuseppe, I'd like to, hear your thoughts about this because, from my perspective, knowledge graphs can represent that system perspective. And they can connect seemingly disparate entities from any one viewpoint. And so obviously, and an individual asking a specific question, Joaquin, to your point, you only need to be given the information that is relevant to the task at hand, right? But I do think that knowledge graphs have the ability to represent that higher level, that system perspective, and all of the different relationships and connections and interplay, between kind of the higher level meta entities or meta concepts, if you will.
Yeah, I agree with this perspective and point, Michelle, definitely, because I think that the capacity of the LLMs is just to rehash information with a not specific and well-driven reason and way, right? Yesterday in my presentation, I put some ideas of a mathematician from Berkeley, and he asked this question: could an LLM ever come up with the idea of complex numbers, of this idea of negative square root -1, right? And the answer was it wouldn't, because all the previous knowledge on this topic was against this idea, right? So that was, I think, an interesting point to understand what LLMs can do or cannot do. But I believe that if you can achieve a systemic perspective using, for instance, knowledge graph technologies, I think that this type of ideas or this type of information or intuition can come up in some way, right? Because obviously the previous knowledge, it's not just rehashed within the system, but it's explicit. So potentially it could emerge from this type of technologies rather than LLMs. That's my feeling on it.
Cedric, would you like to talk about the integration of clinical data with the development and testing of pharmaceutical components? I know that, like, in the pharma domain, you have to have knowledge of multiple domains, and that requires integrating various sources of ontologies, various sources of knowledge. And that's your job title, right? Knowledge extraction and integration. So
exactly. So if we push the thinking to the absurd limit, I mean, you would need one knowledge graph per human being on Earth, because every person has only subjective opinion about things, because it's filtered by the way the brain is working, the experience, the culture, the education of each of us, and it's never objective, basically. And we all depend on the sensors that we have that are working more or less good. As you said, we are not equal, and we all depend on our CPU, our brain, which is also not equal in cognitive abilities. So once we have all these knowledge graphs, we need to bring them together. And here, the fact of representing the knowledge as a graph versus a relational database, which was historically the case because of the design of the storage system based on technical constraint, it's much more fit for purpose and suited to integrate heterogeneous sources of data. So, and especially because we share a metadata. We share RDF, RDFS, and all these fundamental of the semantic web principles. But nevertheless, I mean, even if you have that, you can have different ontologies of different domains because everyone will understand the domain, a concept uniquely. Now you can link basically all the what's the total world population now? 8+ billions, I think, or even 9. No, not yet. I don't think not yet. But you would have 8+ billion definition of what a product is. Now, some people will have the same definition because they work together on SNOMED or IDMP or whatever. And this is interesting because this goes to the Dunbar's number. You know, this famous number that is the maximum that the people can reach out to and keep the contact with, which is around 150%, based on the cognitive ability to maintain a human relationship with these persons. So and funnily enough, it's the size of the traditional primal societies. The clans, they were not bigger than that because you could not have a bigger number of people because then the clan would be divided and they will not be on the same line and not use the same standard to define a product. Basically, not speak the same language, not use the same cultural codes. So this Dunbar's number is really interesting, and that's why we have so many standards and so many to choose from, because nobody is able to agree on one universal one, which is the human nature. So yes, integration, disambiguation, reconciliation is at the heart of any message exchange, whether it's between two human beings, a human and a machine, or even human with other species. Because let's not forget that the way we perceive the world is not the same way a dolphin perceives the world, because they have different sensors, and in some aspect they might be more intelligent than us, so their knowledge graph would be even radically different than us if they represent the world. So I leave you with that, Joaquin, too.
I'm gonna have to masticate on that. Let me see. We probably have one more good meaty question to go through. Yeah, okay. How do we prioritize the implementation of AI technologies? There's the symbolic, there's statistical, there's composites, there's hybrids. What do you guys think?
I'm going to be short on this one. Use case driven scientific methodology. Start with the why. Once you know what you need, then the choice of technology will shrink, and you will funnel what you need to the right technology. There is no one size fits all.
I agree with that. Start with the why and focus on the problem definition. I think is the way to go. Use case driven.
Yeah, I completely agree with this point. And if you think, for instance, when you have to, I don't know, for instance, build an ontology, right, for developing a specific product or for developing a specific service, you start small, right? So you start to define a very specific use case. You identify, for instance, the entities and relationships that are useful for your business goal, and then you start to expand, right? So I think that we should apply a bottom-up approach, while sometimes too many times we adopt a top-down approach in which we develop a technology and then we say, okay, now let's see how to apply this technology on our problems, right? But we should start from the problem in order to adopt and develop the right technology, right? So I think that this should be the direction, I would say.
Okay. What about this modeling problem, data collection problem, privacy problem? If we want to create something, a solution that scales and satisfies use case at scale, it needs to fulfill the needs and requirements of each localized deployed use case. How do we tackle that?
I think that you've asked a really important question, and something that I see organizations struggle with across the board, which is the elicitation and definition of requirements, depending on the use case. It's a skill that I see from a technology perspective is not mature. In healthcare, there are few people who come from the technology perspective who are able to elicit, refine, clarify, help the business clarify their requirements, because you have to have some subject matter expertise to do that. Which is why, I'm gonna put a plug in for people who are clinical informaticists who see an issue from both sides. They understand what technology is capable of, but they also understand the type of information that technologists and engineers and software developers need to develop tools that work for the business people who don't understand technology. And so I think that translator role is really important to getting to technology that really is usable, and that works to solve the problems. We need to, again, focus on kind of the problems. If you don't do a good job of defining your requirements, to Cedric's point, you're a hammer and everything that you have looks like a nail. So I think defining requirements is an area where we could level up, our skill set, particularly related to AI and the development of AI solutions.
So because I'm a knowledge graph geek, I developed a full framework to measure value of what we do. So I have an ontology to capture requirements, link it to the product features, agile development, then success measurement, KPIs. And I even wanted to go down to the financial statement, the profit and loss statement from the different functions, but I never managed to do that. But I'm trying to have that mapped end to end, to measure the value of what we do with the whys, with all the context, with all the stakeholders and so on. And I think to some extent it works, and it disclosed transparently and using open standard, metadata standard, what we're trying to do, so it can always be reused. It's never locked in any system, in any vendor. But then the thing is the humans, because most of them are afraid to see this complexity. And every time I came with that, it was like, this is too complex. So now I'm not showing graphs anymore. I'm just showing one number that they need. So I surface a tiny piece of the graph based on the use case, based on the need. But nobody wants, most of the people, they don't want to open the box and see the complexity.
I've had that same experience in healthcare, that there's just, it's an overwhelming amount of information for certain types of people. And most people who aren't designing solutions, they don't need that level of information, right? And they're just, simply not interested in it. But I think, from a solution design perspective, Cedric, to your point, that all of what you just described is relevant. And we should, I think, strive to, achieve that level of delineation through all of the points and all of the levels, in anything we do, especially related to AI. So I would be interested,
especially
in
related
that and contributing to that. And I'd be interested in hearing it, whether other people would or not.
I would say especially related to human health, because this is the most important asset that we all have.
Right. Right. We want to protect that and preserve it.
Yes.
As much as possible.
With that, Giuseppe, do you have any final thoughts? I mean, we're nearing the end.
Yeah, I think that Cedric and Michelle underlines all the key aspect. I would say that just the importance of building a valuable use case that are able to adopt these technologies is essential, right? Because if we are able to create valuable systems, okay, if the user asks, okay, I want to understand more, then if we have a knowledge graph and an ontology, we can say, okay, this is the answer. But if we have a system in which at a certain point the user asks, okay, tell me why, then if we just use LLMs and generative AI, we are not able to answer, right? So we have to consider also this point when we develop systems, because I mean, people appreciate LLMs because they just interact with ChatGPT and something happens, right? Maybe we have to create the same simple interface when we work on knowledge graphs and ontologies and clarify the point that, okay, you have just having fun, interactive is something that seems smart. But then when you have to work in critical situations, then you want to understand why. And the ChatGPT, yeah, it can show you because, but just rehashing what is in its memory, and yeah, it becomes right an important aspect, especially for critical domains, and healthcare is maybe the most important one. So we should consider this point, I would say.
Well, thank you all. We've had a lot of points to discuss, and bottoms up, use case driven, fit for use. Start small and slowly grow and expand, and then
Human in the loop.
human in the loop. Shake hands with your neighbors to share domain. Um, yeah, I think we got a lot of food for thought, and we may need to emulate that front end to enable adoption of knowledge graphs. I think those are pretty pragmatic takeaways. Um, thank you for your time, and yeah, I'm excited to be part of this group of people and learn from you all.
Thank you for the opportunity,
you.
Ricky.
Thank you very
Thank you
much.
very much. Yeah.